The Self-Advocacy Association of New York State. SANA's Summary of Budget Cuts and Risks to OPWDD Services. September 2, 2020. New York State thinks it will have $64 billion less than the state needs over the next 4 years. Because of this budget gap, New York needs to either get more money or make cuts to the budget. Right now, the state doesn't know if it will get more money, so it has decided to start some budget cuts. The Office for People with Developmental Disabilities will also have to make cuts. OPWDD had already announced cuts that they plan to make to payments for agencies that run group homes. OPWDD has also been told they must withhold 20% of non-Medicaid payments, and we want to explain what this means. Withhold means that OPWDD will not pay service providers 20% of the money they are owed. But service providers might get that money back in the future if New York State gets more money. Non-Medicaid payments that are going to be cut affect some services that people receive, but do not affect all services. We want to explain what services and payments are at risk so that people understand what is going on. One cut affects payments that family support services providers make to others. Another cut would affect housing subsidies like ISS that some people receive when they live in the community. OPWDD has given housing an exemption for now, so no one will be affected by housing cuts until September 30th. Another cut would affect room and board supplements that some agencies receive to support people in group residences. Another cut would affect payments to agencies that are converting ICFS to IRAs. Another cut would affect payments to fiscal intermediaries for self-direction budgets. For people in self-direction, this would affect the money they get for housing. It would also affect the money that people get for other than personal service items that include communication, transportation, utilities, and other payments. The withhold would also affect services outside of OPWDD that people with disabilities rely on, like public safety and education. OPWDD says the withhold on payments already started on August 17. OPWDD says they want to pay people back for the full amount in the future if they get more money, but they do not know if they will get more money. OPWDD has not given us clear information on what is going to happen. It may be possible that agencies and FIs will have to protect people from cuts, and make sure the cuts don't affect their services. But it is also possible that they will not be able to protect people, and people would be affected by the cuts. We want OPWDD to tell us how these cuts will affect people receiving services so that people can plan. We do not know yet if the cuts would mean that people lose services. We do not know yet if the cuts would make it harder for service providers to survive and pay their staff. We do not know yet if people would lose their ability to make housing payments. New York State is not allowing evictions until October 1st, and this may help people who cannot make housing payments for a short time. But we want OPWDD to make clear what they are doing to support people at risk of losing housing during a pandemic. We also want to know if OPWDD will require or encourage agencies and FIS to protect people from cuts. We want to know how OPWDD plans to protect service providers from cuts that may put their agency at risk. We want to know how OPWDD plans to protect people from the health risks that come with cuts to services during a pandemic. We worry that services are already at risk because of changes to funding and operation of day programs. We worry that services are already at risk because of a planned transition to managed care. We worry that services are already at risk because there is not enough funding to hire and pay DSPs. We also know that SANAs as an organization will be affected by the withhold, but for now this will not affect the work that SANAs does. We want people to know what advocacy they can do to protect their services and supports. Now is an important time to advocate to OPWDD and to your political representatives. One way that New York State could get money to prevent the cuts is from the federal government. Congress has passed the HEROES Act, which includes funding for states like New York, and we are waiting for the Senate to make a decision. You can use this site to find your U.S. Congressperson and U.S. Senator and call, email, or write to tell them you want funding for states. If the federal government does not give aid to states, New York State government could choose to take action. You can use this site to find your state assembly member and your state senator to call, email, or write to tell them that services for people with disabilities should not be cut. You can also contact representatives in your city or region to ask them to support people with disabilities. SANS has written a letter to the Commissioner of OPWDD asking to protect people from these cuts. We will continue to advocate on this issue, and want to hear from you about how to advocate. You can sign up for the SANS email list with your regional coordinator, follow us on social media, and attend our online meetings to stay informed. Stay involved with SANS so we can keep you updated. You can find us online at www.sanas.org.